Lecture talking about cranial sutures. Of course, the cranium is a very important bone, or structure of the bone of the head. Simply, the main purpose is to protect the brain. So, cranial sutures. YouTube video. Cranial sutures. Simply the joining together of two or more cranial bones. So it's kind of fitting together like a jigsaw puzzle. All right. Important areas of or important sutures of the skull, and therefore, all right, the corneal suture, sagittal. Here. All right, so the corneal suture, sagittal, lambdoid suture, and the squamosal suture. So again, the cranial suture, all right, is simply just fibrous bands of tissue that connect the bones of the skull. So the coronal suture, we'll find that actually, as you see here, let me probably switch that up. It's already highlighted in red here, but emphasize in yellow. Okay, right around there. Again, these two bones, actually, the frontal, this part bone, everything just kind of fitting together. All right, so that's basically where the coronal suture is. All right, sagittal. So again, this is the top of the head. This is the back. This is the top of the head, and just right there at the top of the head. All right, as you see, this is the face, the front, sagittal suture. Lambdoid towards the back. Okay, it's a fibrous material holding these things together, fitting in like a jigsaw puzzle. Right. And the squamosal, that's actually the smaller suture part right here, as you can see. Okay. All right. Again, it's the joint of the parietal and the temporal bones. Now, one thing, just real quick, actually, in terms of newborns and real young kids, their bones are a little soft, more malleable, and the sutures are not completely, and that's kind of throughout the body, but the sutures are not completely, some places like fused together. So that takes some time to do that. That's why you have to be careful with the heads of newborns, because it's not quite placed together, fused together properly. All right, the axial skeleton. So as you learn, we have the appendicular skeleton and the axial skeleton. The axial skeleton is like the head, the vertebrae, and the pelvis area. And these are just areas right here, and you're already studying. You already have studied them or are studying them, right? So just kind of remind yourself the areas here. Okay, so you got the frontal bone pointing to this area right there, right? All right, the ethmoid bone. And this is around in this area. I don't really want to use, if I use the marker, it will just be one big mess on the skull. All right, vomer bone, right around in this, so just kind of follow the lines. All right, maxilla, right here, this purple area. The mandible, this part. So as far as it is with our teeth, the upper teeth, that's the part that's attached to the bone, that's really attached to the main part of the skull that does not move. This part, all right, is a part that of course moves. All right, the mandible. All right. All right. The lacrimal bones. All right. Ethmoid, again on this side. Temporal, kind of like your temple pieces, like if you wear glasses, and the part that goes from, this part from your eyes to your ears. All right, that's the temple piece of the glasses. Right, symphysoid bones, nasal, right here. And as you see here, you can see the sinus cavities there, parietal bone. Okay. So that's the anterior view of the cranium facial bones. All right, this is a lateral view. And I think pretty much the same thing that I have highlighted in red here were the same ones that I mentioned in the anterior, but just, you know, kind of give me just a different look at it. Again, remember, these are the sutures. All right, and you see the lambdoid sutures. So here you have the sutures going across here, and the sutures are mentioned here as well. All right, so that's very important. So that, again, that's the lateral view. And then just simply just the posterior or the back view. Again, sutures. Okay, as you see here. All right, parietal bone, posterior, and underneath. Of course, it's where right here. You need another color to see. That's too dark. But right here, of course, that's where the vertebrae is going to fit in, and the maxima, and all the different bones here. Again, same bones, but just simply just a different angle. All right, and that's the inferior, kind of going from underneath.